Good morning everybody, wakey, it's time for Morning Glory. My name is MC Kalia and I'll be your captain for the next 1 hour 30 minutes. Let's have this conversation going. Good morning everybody, wakey, it's time for Morning Glory. My name is MC Kalia and I'll be your captain for the next 1 hour 30 minutes. Let's have this conversation going.
Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophill Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophill Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophillhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophillhospital.com. Tophill Hospital, exceptional technology, extraordinary care.
Month of 2023. My name is MC Kalia. This is the Morning Glory Show, the Healthy, Wealthy, Wise edition. Being Wednesday, of course, I would want to continue wishing you, of course, a happy week. It is midweek, katikati ya wiki, so many things happening around you. And just like any other day, I would also want to really ask you that in a world that you can be anything, be kind. Back to the Healthy, Wealthy, Wise edition. With us today in studio is Dr. Kevin Ruto from Tophill Hospital to take us through common pediatric cardiovascular diseases, or just in simple terms, common cardiovascular diseases in children. These are diseases that affect children, or rather babies and children. Okay, Dr. will be in a better place to explain that, but then before I give him a chance to allow me to remind you that we are coming live from Dawi Afrique Photography. Dawi Afrique Photography is a photography studio based in Eldoret, Zion Mall. That's exactly where we're coming live from, and in case you need anything that goes into video and photo production, consider working with Dawi Afrique Photography. Nonetheless, if you are interested in fashion, D-Square Fashion House is the place to go. If you want to dress to be addressed, walk into D-Square. And by the way, yesterday we were the CEO of D-Square here. You could see that actually that's a place you need to visit. It's a place where all the important people are dressed. And I keep on telling you every other time that wewe ni mtu wa maana sana. So make sure that you walk into D-Square and get to be dressed so that you can be addressed. In addition to that, if you're interested in learning the art of fashion, they also have a school called D-Square School of Fashion Design and Tailoring, where they offer courses to train you how to dress people. With that, allow me to welcome Daktari. Of course, he's been here before. Dr. Kevin Ruto is a resident medical officer at Tophill Hospital. Tophill Hospital is a level 5 brain and spine hospital based in Elgonview, still within Eldoret. Daktari, karibu, say hi to our viewers.
Okay, thank you very much, MC, for your warm welcome. It's yet another day that you're going to be talking about our health. The last time I was here was the week of love. That was in February. Human love. And this week, it's yet another time. We are now sharing God's love. Happy belated Easter for those people who didn't manage to. So it's
and exactly, of course, you maybe one day need to tell us if it is a condition that ladies have, because somebody has been asked already, umeona ukuninulia kitu ya Pasaka, as if they were Jesus Christ. Anyway, that is on a lighter note, Daktari.
So we'll get started just to make a brief introduction of our today's topic. We will be talking about common cardiovascular diseases in children. What we call in pediatric age group. This is until about, pediatric age group goes up to around 18 years, at least in our country. So it extends to that point in time. So cardio basically stands for the heart, okay? Then vascular means with vessels. So a majority of the things that we'll be talking about will be related to the heart and just the vessels. Vessels meaning arteries and veins. Those are some of the few things that we'll be talking about today.
Okay, thank you so much, Daktari. And of course, if you're already tuned in, then you can help me share the broadcast. Of course, as we talk about health, we would want everyone to be part of this. Let's talk about these ailments, because they affect our day in, day out livelihoods. Of course, so many people right now also maybe expecting to have children in the future. You also need this particular knowledge. So let me know where you're tuned in from. Leave a comment, like the show, and every other time I'll be reading your feedback and all the questions that you would have asked Daktari. Now, Doc, of course, you've given a brief introduction of these particular conditions, and we would maybe go down a little bit and also categorize them. Of course, you would earlier indicated in the concept note that there are those that are congenital and those that are acquired. What exactly does that mean?
All right. So, cardiovascular diseases in children majorly can be classified into two, just as you mentioned, congenital versus acquired. Congenital, basically what that means is that these are conditions, these are anomalies that babies are born with. So basically they mean that these are anomalies that really originate from abnormal formation in utero. That is even before birth. So these are conditions that a child is born with, okay, that can actually compromise on maybe their life, their growth, and all that, okay. Versus now acquired. Acquired means these are something that was not there at birth, but then later on, as you grow, probably for one reason or the other, you get them, you acquire them. So those are the two major classifications, okay. Of course, the going down deeper, for example, we'll now talk about, I'll focus first with the congenital heart diseases. Number one, it will be of importance that we get to understand how really the babies get to perfuse. Perfuse means get to circulate blood through all their organs in the body. In utero.
And Dr. Maybe before we come to that, I'm sorry to interrupt you. Now that you've actually classified them into those that are congenital, meaning that they were there during birth. Maybe before we go into looking at how babies circulate blood and all that, are there known causes of diseases, or rather conditions, or what causes the kids, or rather the babies, to be born with these particular conditions?
So I was just about to head there, but just trying to break fast the understanding so that we can really get to know why does it happen. So I'll go back still to understanding the circulation of blood in babies. One thing that you get to know is that there is usually no direct communication between the mother and the baby when they are in utero. That means when they are in the womb. Okay, meaning there is a bed between the placenta and the uterus. There is usually a bed there that allows exchange of nutrients and oxygen from the maternal side to the fetal side, which is to the baby. Okay, so once that happens, therefore, from this placenta, blood usually goes to the baby through something called the umbilical vein. That is why you're seeing the navel there. It's because that is where actually at some point you are being fed through that part. You'd receive your oxygen and your nutrients through your navel. Okay, so once it goes there, this usually goes through something called ductus venosus all the way to the liver, all the way to the vena cava. Vena cava, the ones that we talked about when you were in primary. Then from there, blood goes into the heart. That is, we are talking about fetal circulation. From the heart has 4 chambers. One of the chambers being the right atrium. You go to the right ventricle. From there, blood circulates all the way. We also have the left atrium, left ventricle. As from the usual understanding, from the right atrium, blood usually flows down to the right ventricle. Then it goes through something called the pulmonary vein. That is called pulmonary circulation to the lungs. Then it comes down through the pulmonary artery to the left atrium, which is part of the heart, to the left ventricle. Then now it goes all to the systemic circulation, which is now to the whole body through the aorta. Okay, so that is the normal circulation in you and I. But in children, it's a bit different. How is it different? One, because this child is receiving nutrients and oxygen from the mother. It means in utero, a fetus lungs do not function. It's usually bypassed. Okay, so blood flows through the right atrium into the right atrium. From the right atrium, there is usually a communication between the right atrium to the what? To the right, to the left atrium. through something called a foramen ovale. Why do you do this? Why do you make this shift? It is because you don't want blood to go to the right ventricle so that it goes to the lungs. You just shift it direct to the left atrium. It flows to the left ventricle. Then now it flows into systemic what? Circulation, bypassing the lungs, which at that time, usually it's maturing. Okay, those are some of the things. Besides that, there is also another alternative route. Okay? In case blood flows into the right atrium, into the right ventricle, then flows through the pulmonary vein, which is supposed to take to the lungs, there is usually something called a patent ductus arteriosus. It is also another bypass. Okay, where is the communication? The communication now is between this vessel that is supposed to take blood to the lungs and the aorta, which is supposed to take blood to the systemic circulation. Okay, so there is that communication before you go to the lungs. So blood, yes, from the right ventricle goes into the pulmonary vein, but does not get to the fetal lungs, bypasses and goes to the aorta direct, then into the circulation. Okay, so there is the other alternative route. Now, why did I have to explain all this? It's because a majority of the congenital malformations originate from what? The whole of this circulation problem. Okay, so I'll swiftly go into classification of these congenital heart conditions that you're talking about. Now, congenital heart conditions in children can be classified into two. They are either cyanotic or what? Acyanotic. In medicine, cyanosis means blue in color. And whenever you get blue, it means you get blue when you're not receiving enough oxygen. Okay? That is cyanosis. Acyanotic, is a negation, meaning that acyanotic
Karibu Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophill Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophill Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophillhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophillhospital.com.
Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going.
For that call here, of course, Dr. will explain something about difference that happens the babies of the womb. We experience technical. You may not actually get my pictures quite. These are from time to time, but because Dr. will still be about this. Dr. we're telling something about once the baby the womb.
Once the baby has left the womb, you lose the connection. You lose that link between the mother and the baby. It means therefore it's now time for this baby to take up the responsibility of taking in their own oxygen and circulating it through all their body. Okay? When does that happen? That ideally should happen immediately.
I think it's still experience in the same technical age. I don't know what we...
Karibu Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive